Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into Mon Health Talk. I'm Dave Wilson. Believe it or not, we are quickly closing in on the 2022 Ball of the Year. Joining us on today's show is the chair of the Ball of the Year, Sarah McBride, and prenatal mood and anxiety disorder nurse Jennifer Bender. Sarah and Jennifer, good morning. Thanks for joining us today.
Good morning.
Good morning.
Well, it's hard to believe, but we are just a couple of months away from the 2022 Ball of the Year. We'll get into that, how you can get your tickets, and talk about what the ball is benefiting this year. But I can't let you off the hook without talking about yourself just a little bit. Let's see, eeny, meeny, miny, mo. Let's start with Sarah McBride, chair of the 22 Ball of the Year. Just tell us a little bit about yourself, your background, and how did you get designated with this illustrious title?
Sure. First, thank you so much for having us this morning. It's great to be here again. I got started actually with the committee back in 2019 and supporting the Ball of the Year as a committee member, and had so much fun and was really glad that they invited me to chair for 2020. As we know, with COVID and everything, things got extended a little bit, so I've had the honor of holding this title for a few years now. So to see our finish line closing in is quite a gift. So I love Mon. I have 3 little boys. 2 of them are born there, and I've had the benefit of being taken care of by all their wonderful doctors and nurses, and I'm just very grateful to them.
And Jennifer, I said prenatal. It's perinatal mood and anxiety disorder nurse. Sometimes my eyes like to tell my brain different things when it comes to rearranging letters. But nonetheless, Jennifer, tell us a little bit about yourself, your background.
Thank you so much. Mine does the same thing. No worries. So I am a nurse and a lactation consultant. I've worked at Mon Health for 15 years now. My family and I moved here 16 years ago from Maryland. We love West Virginia and have raised our family here. So I was a labor and delivery nurse for 18 years and then transitioned to the role of perinatal nurse navigator. And basically, I reach out to our moms and let them know we're here to help, follow up on screenings when moms show signs of needing help. I love this role. I feel like I have lots of experience and expertise to just help them when they need help.
The Ball of the Year comes up in November. I believe it's November 5th. Is that correct, Sarah?
That is correct, yes.
So are tickets on sale as we speak?
As we speak, yes. They went live on Friday the 9th at 9 a.m. So the website is up and ready for your purchase.
Well, you know, the next question is, how do you get tickets for the 22 Ball of the Year?
Sure. We have worked hard to make it very easy this year. If you go to www.theballoftheyear.com, you'll see information about the whole event, including how to buy your tickets and sponsorships if you're interested.
And that is, I want to make sure, give the website again.
Sure. www.theballoftheyear.com. And you'll see lots of tabs there, but tickets are under the tickets and sponsorship tab.
And make sure you get theballoftheyear.com. If you leave the out, you'll go someplace else, and that's not going to do any good. Theballoftheyear.com. So where is the Ball of the Year this year, Sarah?
We are glad to be back at the Morgantown Event Center.
And getting that space ready, can you give people a little sneak preview of how you will transform that space, what it'll look like for the Ball of the Year coming up November 5th?
Well, I can't give away too many details, but I will say that we are in the midst of undergoing a massive transformation, and we're really excited to just bring all of the beauty of our area from the outdoors to the indoors. So thinking it's going to be very luxurious, very organic. We really are trying to infuse something very whimsical and meaningful into this event.
What is the theme of this year's Ball of the Year?
Appalachian Revival. We actually chose this theme back in 2020 before COVID. It was January of 2020, so just right before. And so as a way to celebrate and support our culture and community. And I think that with everything we've been through with COVID and everything has just become so appropriate and essential for us as a whole.
You know, we get to speak to you and you're chairing the Ball of the Year, but how many folks does it take to put this event on, to decorate the event space, to manage all the things that go into such a large event? You've got a great support team there. We
do. I mean, it's true. It takes a village. And not only does it make it more fun and more meaningful, but there's so many facets that come with an event like this, especially with our theme. So we just have multiple teams that are pulling together, and I'm so grateful for all of the time and energy that our committee has put toward this.
Talking to Sarah McBride, she's the 2022 Ball of the Year chair. Jennifer Bender's also with us, perinatal mood and anxiety disorder nurse. And Jennifer, this year's Ball of the Year, I don't know the correct order there, what is it benefiting?
Yes, it is benefiting our families. Mon Health is a great community hospital, and we have a mission to serve our patients, and we're doing that well with this program. So we know that 1 in 7 moms will experience some type of perinatal mood or anxiety disorder, with depression for some. We used to think it was 1 in 9, but actually when we started surveying all moms through their pregnancy and after delivery, we realized that number is actually higher now that we're actually screening for it regularly. So 1 in 10 dads will also experience symptoms of postpartum depression, anxiety, or mood disorder. So all of these proceeds are going to support our families, so their health physically and mentally, because we know if we treat this disorder early, we can interrupt the cycle and get mom and dad feeling better, which just makes the family unit so much stronger. So this is truly supporting all facets of our community.
And that program you're talking about is the P3 program, correct?
That's correct.
All right.
Yep.
Go ahead. What does P3 stand for?
It stands for Progressing Through Postpartum, because we know it's a journey. It's not just the day the baby's born or even a week or two after. It's all the way to a year and beyond.
And we'll talk more about that program, your role in it, how you treat patients, and all the above. Plus, how you can participate in the Ball of the Year as well, as we continue our conversation with Sarah McBride, 22 Ball of the Year chair, and Jennifer Bender, perinatal mood and anxiety disorder nurse. Will continue as Mon Health Talk rolls on here on the Voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest today, Sarah McBride, 2022 Ball of the Year chair, and Jennifer Bender, perinatal mood and anxiety disorder nurse. The Ball of the Year comes up on November 5th. Tickets are on sale now as we speak. You can go to theballoftheyear.com for tickets. And Jennifer, we touched on the P3 program there before the break, and you kind of gave a broad overview, but I want to get a little bit more specific. Can you tell us a little bit more about how that program works?
I sure can. So at Mon Health, when our patients come in for their first OB appointment, we screen them for symptoms of depression, anxiety, and mood disorders with a quick, easy tool. We do that again about midway through the pregnancy, 28 weeks, and then when they deliver that precious baby, we're going to screen them again. And again, when they come back for their postpartum appointment around 6 weeks, we're going to use that same tool. It's a quick 10-question survey. It gives us a nice assessment of how things are going. A lot of us are not very introspective about how we're doing. We may know we're feeling anxious or depressed, but just not sure where does that measure for other people. So we take that data and we start outreach. So one of the things that's unique about our program is we outreach our patients. So not only do we address that you scored a little high on this and what can we do for you, But after you have your baby, I'm going to reach out to you through text technology and see how you're doing. So we don't wait for you to start having a problem. We let you know there are resources available before you even have symptoms. So once we have that data and the families want to get help, I send them for a therapy referral. We talk to our doctors about medication to help treat symptoms, and then do follow-up to make sure we are having improvement of symptoms. So I feel like it's a wraparound program, not only for screening and detecting, but for being very active and reaching out.
Is this program for new mothers, or is this program also for second, third, fourth-time mothers?
Yep, it's for any mom that delivers at Mon Health, whether it's your first baby or your eighth baby. And I have had moms that come in for follow-up. I actually had a mom come in for follow-up on her eighth baby with lactation support, and I thought that was amazing. Because everybody thinks, well, you've done this a few times, you know what's going on. But every baby is different and unique, and every addition to your family changes the dynamics of your family. So, whether you're experienced or not, you can have new symptoms when you've never had depression or anxiety with the next pregnancy.
Generally, obviously, when we talk about this, we're talking about the mothers. But is this exclusively for mothers, or is this available to help the entire and support the entire family?
So the screening process is for the moms because they are our patient, but the family is our whole responsibility. So although the risk is less for dads, we still have dads that are experiencing symptoms, and I have sent referral information for dads as well. So always happy to wrap around the family and get everybody the help they need.
So I'm trying to figure out how to ask the question. What kind of feedback do you get? I mean, I'm sure your patients go, wow, that really helped, or I never thought about it in this way. Do you hear those kinds of comments often?
Yeah, so we actually survey our patients, and we have some really good data about how well this is working for our patients. I like to tell people when they get the text message, it's not an auto text. It is physically me sending them a message. So they're not getting a robo follow-up. It's literally me. And I have another coworker that has taken over some of that job for a pregnant patient, so that's really helpful. It's a program that is just really unique, and our feedback is awesome. Most people that we hear back from when we send them the survey via text message have nothing but high praise. Of course, we have some areas of improvement, and we've used that data to update. We were following through about the first month, but now we've started sending out additional contact around 3 months because, postpartum depression, anxiety, and mood disorders don't just hit in the first 6 weeks. It's up to and beyond the first year, especially untreated.
Jennifer, let me ask you this question. Are we having more instances? Because you said it's, I believe, 1 in 7 women, correct, that experience some sort of postpartum depression?
That is correct.
Is it that it's happening more often, or are we better at recognizing it and more open about it in 2022 than we were 20 years ago or 50 years ago, for that matter?
Yeah, that is a great question, and I've been asked that several times. In my view, I think it is not more frequent. I think we just are asking the question, and more people are not afraid to report symptoms. I don't really prefer the term mental health, although that's what we refer to it as. It's really brain health. Your brain is a part of your body as much as any other of your organs. And I also tell people, we don't make diabetics feel bad about needing insulin because their pancreas isn't working. Why should we make people feel bad for getting treatment for a chemical imbalance in their brain? You have no control over that. So I think just awareness is so much better today. And a positive of the pandemic is people are really reporting their feelings and thoughts and how their brain is not functioning the way it should. So I think it is absolutely as prevalent as it always has been.
Quick question before we take the break. Do you have a specific use in mind for the funds that are going to be raised by the Ball of the Year this year for the P3 program?
Yes, we plan to continue expanding this program. Right now we have 2 people actively working in it, but we know the need is great. Our next step is to add our own therapist. Currently we refer out because this is a specialty area, and we are looking to get our own therapist, one, for speed of access, because it's very important they get help as soon as possible and we don't delay. And then our long-term goal is to have our own freestanding center with lots of wraparound services for the family. So that's where these funds are going, and it is truly an amazing program and something worth donating to.
Sarah, you still there?
I am still here.
All right, we're going to go over the specifics on the Ball of the Year one more time, but I got to squeeze in a quick break. Jennifer Bender, perinatal mood and anxiety disorder nurse, and Sarah McBride, 22 Ball of the Year chair. They'll continue with us in a moment on Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health System and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Been talking about the Ball of the Year 2022. That comes up November 5th. Tickets on sale at theballoftheyear.com. Sarah McBride is the chair of this year's event. Sarah, can I still participate or donate to the cause this year, even though I may not be able to attend the Ball of the Year?
You sure can. We have actually a couple of different ways this year that you can participate or donate. If you go to, again, theballoftheyear.com, under the Tickets and Sponsorship tab, you'll see a space for cash donation. And we are so happy at folks' generosity in using that. Also, on the P3 tab on the same website, all the way at the bottom of the page, there's a Donate Now button. One thing that is different this year is for folks that are not able to attend the event, you are going to be invited to still participate in the silent auction that's happening, and we'll have that information on our website as well, and also on our social media pages.
And Sarah, if people want to attend the Ball of the Year event, we've given the website a couple of times, but you're better off to go ahead and get your tickets early than wait around, correct?
That is for sure. If we do sell out of tickets, we will move to a wait list. And if you have any questions, you're welcome to contact us at theballoftheyear@gmail.com.
theballoftheyear@gmail.com. And that's also the website, theballoftheyear.com, where you can get your tickets for this year's event, November 5th. And what is the theme again this year, Sarah?
Appalachian Revival.
Sounds like it's going to be a good time. And Jennifer Bender, also with us, perinatal mood and anxiety disorder nurse. This year's funds raised from the Ball of the Year will be benefiting the P3 program. And Jennifer, where can folks get more information about the P3 program or reach out to you all?
Yeah, on our Mon Health website, we have an area where you can go to maternal mental health, Mon Women's Health Clinic. And there's lots of information there. My cell number is there for you to reach out to me, and I'm happy to hear from anybody. We support anybody that reaches out to us. We focus on our patients that have delivered, or even if they had to go to Ruby for higher level of care, if they started their care with us, we follow up with them. But we're always happy to support anyone in the community that has our information and reaches out.
It's the 2022 Ball of the Year. It is back, and it benefits the P3 program. Sarah McBride, our Ball of the Year chair, and Jennifer Bender, perinatal mood and anxiety disorder nurse. Guys, thanks so much for spending some time with us this morning, and I'm sure we'll check in again soon before we get to that event date on November 5th. Easy for me to say. Thanks so much, guys. Appreciate it.
Thanks for having us.